I nominated the sexual health team who were working at the Ipswich Hospital in the clinic there before we moved into this building, because I was so impressed with the way they coped with the reduced circumstances for 7 months from later on in October until the middle of May this year when we moved here, when basically our premises were reduced from 8 clinical rooms to 2 clinical rooms, plus we had the part-time use of a room in the Terence Higgins Trust building in the centre of town, because the team held together in incredibly cramped circumstances. We looked after all our HIV cohort, and we also managed to look after quite a substantial number of GU patients.
For some of the patients it was a big change because they'd been used to a great big space and of course not having to share it with different faces and people within uniform, whereas we're out of uniform of course. But again, they coped very well, the ones that we saw at Ipswich Hospital, to get the very best service as they had previously. And I think on the whole they felt sorry for us being cramped into a small space, but we were still able to triage over the phone, signpost them to other specialities, signpost to our sister clinic over in Bury St Edmunds, and we still saw the emergencies.
It was definitely a big challenge, and to try to actually make the service available to the most important group of patient. However, all the patient is important, but we did give the priority for complicated cases, something similar to HIV patient or complicated sexual health presentation.
This building, this refurbished building, is obviously incredibly many times better than what we had for 7 months.
Very, very welcomed, lots of space. Car parking space is fantastic. We don't have to pay for our car parking, which is brilliant for everybody. Early and late starts and early finishes. It's a very private area. The clinical space is excellent in comparison to what we were in before.